If you or someone you know is dealing with pelvic organ prolapse, it comes with a lot of emotions. There's a lot of uncertainty, people are scared, they're nervous, and have a lot of fear around this diagnosis. Even if you're having symptoms of pressure or heaviness in the vaginal area and you're looking up your symptoms and think you might have a slight prolapse, do not fear. There are a lot of holistic natural options, and today I want to talk about those because there are alternatives to going under the knife and having surgery, and it's important to know all of those options before you sign up for a surgery. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, and after so many years as a women's health physical therapist and treating a lot of women for prolapse and prolapse-related symptoms, there are better solutions at times, and also you want to explore all alternatives before jumping into a risky surgery. Now, even if you were recommended to have a surgery, whether it's for bladder prolapse, uterine prolapse, rectal prolapse, it's important to get more than one doctor's recommendation and also get their advice and their guidance, because there are different types of surgery, there's different methods, different strategies, and so you definitely want to explore more than one option. But in the purpose of this video, talking about options that don't require surgery and other things that you can do to help it, I'm going to talk you through those. So what is prolapse? Well, when you have some changes in the vaginal wall and you have some weakness or extra pressure or things like weight gain after pregnancy, menopause changes with hormone changes, a lot of things happen down in that area. And if you have weakness in that area, the pelvic organs can actually prolapse or put more pressure on that vaginal wall and create what's pressure, heaviness, or uncomfortable feelings, sometimes even seeing like a little bulge through the vaginal area or rectal area. And it is not your organs falling out, I promise. That's what I hear a lot, but it's actually the vaginal wall caving in, and that is more of what you're feeling and what you're seeing. Some women feel a sense of pressure or fullness or heaviness down there, or even changes in their bowel or bladder symptoms as well. So it's important to know that with a lot of those symptoms comes sometimes uncomfortable feelings sitting or standing, especially at the end of the day. They may feel more pressure or heaviness. And those are the symptoms I'm talking about that can be helped and be eased with more natural holistic options first before signing up for surgery. So number one is lifestyle changes. I have heard time and time again that some of the things that have to do with your lifestyle are actually aggravating the problem and making things worse. Now, maintaining a healthy weight. If you recently have gained a lot of weight, this can also put pressure through your pelvic area and put pressure down in that area that you didn't have before. And when you're up in a position where those pelvic organs are having more pressure and you have more weight around the middle, that also can contribute to more of the symptoms. So also, if you are overweight and you combine that with weakness of your muscles down there and lifting anything heavy or strenuous and doing it the wrong way, those things are going to exacerbate prolapse symptoms or even create more of a different level of prolapse, whether you have a stage 1 through a stage 4 being more of a serious prolapse and stage 1 being a very mild prolapse. That can exacerbate and make things worse if you're lifting something heavy and you're breath holding, or you're putting you do the Valsalva maneuver or put a lot of pressure downward on your pelvic organs as you're lifting. I've heard before from women that maybe went back to the gym too quickly after having a baby, did heavy deadlifting or squatting, and therefore caused some of those symptoms. Or they were moving and they moved a couch and didn't quite think about how they were using their core muscles and their pelvic floor muscles and put a lot of pressure down there. That can initially spike the symptoms and start things from happening from there. Also, if you have chronic constipation, you're not having enough fiber in your diet, or you have some digestive issues, it's good to take care of that and figure out what is actually causing the constipation. Hydrating a lot, and also using good bowel habits and strategies when you are on the toilet, with exhaling and not bearing down too much and pushing, because that can also cause a prolapse or make prolapse symptoms worse. So looking at those lifestyle changes and what you can manage, and learn how to breathe properly through those things, and getting on a healthy lifestyle plan can definitely make your prolapse symptoms better. One last thing I'll mention in having to do with lifestyle changes, sometimes women will come to me after they've had bronchitis or they got really sick, and having a chronic cough over time, you are going to be putting more pressure down on your pelvic area and increasing that pressure in your intra-abdominal cavity, and therefore can make your prolapse symptoms worse as well. So taking care of yourself and finding strategies to help each one of those, what I mentioned, is definitely going to ease your prolapse symptoms. And if you're also working with a pelvic floor therapist, they can help you manage some of those symptoms and teach you some healthier habits that can carry over into easing your symptoms and making sure that your prolapse is actually improving and not getting worse. So with a pelvic floor therapist, the second thing I want to mention is doing the right types of exercises. There are a lot of core related exercises, and even Pilates, which is what I preach and what I love to teach my clients. But if you're doing a lot of abdominal work and you're not doing the proper exhale as you engage your abs, and think of engaging the muscles from the pelvic floor to the abdominal region, I have some other videos explaining this, the proper way to do it. But if you're doing a lot of breath holding or core work where you're bearing down on your pelvic floor, that is also going to exacerbate your symptoms. So it's easy to want to lift weights and doing more strenuous activity, but if you're not doing it correctly with good habits, that can make prolapse symptoms worse, or even trigger some of those symptoms from starting too. So what do I mean by that? Well, as a general rule, if you're lifting weights, you want to exhale as you're lifting. So coming up from a squat, or coming up from a lunge, or lifting anything heavy, you're breathing out at the same time. This will equalize more of that pressure down on your pelvic floor organs and create a better system where your pelvic floor doesn't have as much pressure on it. You also want to imagine almost like a little tiny Kegel, where you're pulling in and up from the vaginal opening and squeezing those muscles as you exhale. This is good to do anytime you are lifting anything, or you're doing any kind of core exercise work that you think of from the bottom up. So we want to think of from the pelvic floor, engaging that first before you really use your abs. And this way you're going to protect those pelvic organs, and it will create a better pressure system for your pelvic organs so they don't have as much irritation around there and pushing down on that vaginal wall. The next thing after all of that, and yes, a pelvic floor therapist can coach you through a lot of these things that I mentioned before, and really find out for your specific prolapse what is the best solution for it. There is a lot of good alternatives and healthier things that you can learn to do on your own that is going to affect your daily habits and your symptoms on a daily basis too. The next thing is hormone balance. If you're a woman over the age of 40, 45, and you start going through perimenopause, your hormones are shifting, your estrogen levels are fluctuating, and as estrogen levels drop toward menopause, you will notice more symptoms because estrogen affects muscle tone. And muscle tone of the vaginal wall is also going to affect symptoms of prolapse or having increased bladder problems, leaking frequency, and this commonly comes up in that menopausal stage. So talking to your doctor about getting blood tested, making sure your hormone levels are tested, and addressing it from there, whether or not you go on hormones and what an alternative or what a menopause specialist doctor I highly recommend seeing. Sometimes you have to pay out of pocket for that, but it's totally worth it when you want these unwanted symptoms that creep up when you're in this midlife stage. And bladder and prolapse issues tend to be more common in this stage as well. So figuring out your hormones and getting that addressed, whether they prescribe you with some estrogen cream or they figure out ways to balance your hormones, that is also going to be key in helping that vaginal wall, and so you don't have as much atrophy meaning weakening of the muscle tone in that area. Next is a vaginal pessary. Now, a pessary is a device that you actually will be fitted for with your doctor, and this device can be worn all day long or it can be worn just during activity. This actually it's a device where you insert vaginally and you're fitted for it, so that way you can be more comfortable with it, but it actually holds things in place. And this is a huge relief to a lot of women who end up seeing us for pelvic floor therapy and working on the right strategies and exercises for their pelvic floor muscles and their core. But then if they want to do things like running, jumping, lifting, and they don't want to have their prolapse get worse or feel those symptoms, they will get fitted for a pessary. And it can be a great balance between managing it holistically without having surgery. So in conclusion, just remember, you have other alternatives, and I would highly recommend trying all of those before signing up for surgery. Yes, surgery can be highly successful for a lot of women, but it's important to address what your habits are and lifestyle changes so the surgery is actually successful, including having your muscles work properly and having a good solid foundation from your core and pelvic floor so you can recover even better as well. Now, I hope you found these suggestions helpful. Let me know if you have tried any of these, and if you have not exhausted all these options, then comment below. I want to hear from you what other questions you may have around prolapse and what you were offered as a solution. So thanks so much for watching. Hit subscribe if you haven't already, and I love talking about these things to help you live a happy, healthy life and guiding you in the right direction when it comes to your women's health concerns. Have a great day.